Welcome back to Golden Years Health. Today, we're diving into a topic that's often overlooked but profoundly important for women over 70, the delicate balance between necessary health screenings and those that, at a certain age, might actually do more harm than good. It's a nuanced conversation, one that's often not had in the hustle and bustle of a doctor's office. But here, in our quiet corner, we'll explore it together. For decades, we've been rightly taught to be proactive about our health, to get regular checkups, to screen for this, test for that, and this approach serves us incredibly well for much of our lives. But as we gracefully enter our 70s and beyond, the landscape of our health, our priorities, and even the very risks and benefits of these screenings begin to shift. The goal isn't to discourage medical care, far from it. It's about smart, individualized care. It's about understanding when a screening, designed for early detection in a younger population, might lead to unnecessary anxiety, invasive procedures, and a cascade of interventions that diminish, rather than enhance, our quality of life in our golden years. We're talking about choosing peace over panic, comfort over unnecessary intervention, and truly aligning our healthcare decisions with what matters most to us as individuals. This isn't a one-size-fits-all discussion, but rather an invitation to a thoughtful dialogue with yourself and your trusted healthcare provider. Let's begin by understanding the foundational principle here, the benefit-to-harm ratio. For many screenings, especially for aggressive diseases, early detection is paramount when there's a long life ahead to intervene effectively. But consider a situation where a slow-growing cancer is detected in a woman of 85. Would the treatment, often aggressive chemotherapy, radiation, or surgery, significantly extend her life in a way that truly improves her quality of life? Or would it steal precious months or years of comfort, vibrancy, and independence, replacing them with fatigue, pain, and recovery? This is the heart of what we'll be discussing today. It's about personalizing prevention, moving away from universal guidelines that don't always respect the unique context of advanced age. The first checkup we need to critically examine and often reconsider after 70 is routine mammograms for breast cancer screening. Now, before anyone jumps to conclusions, let's be absolutely clear. Mammograms have saved countless lives, and for women in their 40s, 50s, and even 60s, they are often unequivocally beneficial. They are excellent at detecting rapidly growing, aggressive cancers at a stage where intervention can lead to a cure and many years of extended life. However, after the age of 70, and especially after 75 or 80, the calculus changes significantly. Why? Several reasons. Firstly, as women age, their breast tissue becomes less dense, making mammograms easier to read. But more importantly, the types of breast cancers that tend to develop in older women are often slower growing. They may be what physicians call indolent, meaning they might never cause symptoms or become life-threatening within a woman's natural lifespan. Imagine a small, slow-growing tumor that would take 15 or 20 years to become clinically significant. For a woman who is already 78, that tumor may never be a problem. Detecting it, however, often triggers biopsies, surgery, radiation, or hormonal therapies. These treatments come with significant side effects: pain, fatigue, scarring, risk of infection, and for hormonal therapies, potential bone loss, hot flashes, and mood disturbances. For many older women, particularly those with other chronic health conditions like heart disease, diabetes, or arthritis, adding intensive cancer treatment to their existing health challenges can severely diminish their quality of life. The average life expectancy at 70 for women is around 15 years. At 80, it's about 9 years. We must ask, are we treating a disease, or are we treating a number on a film? And at what cost to precious remaining years? The screening guidelines themselves reflect this evolving understanding. Many major organizations, like the American Cancer Society, suggest that regular mammograms continue as long as a woman is in good health and has a life expectancy of at least 10 years. But what constitutes good health for a woman in her late 70s or 80s? It's a deeply personal assessment. For some, active surveillance, closely monitoring any breast changes through self-exams and clinical exams by a doctor, rather than routine mammography, might be a more sensible approach. The emphasis shifts from early detection of any abnormality to detecting clinically significant abnormalities that would genuinely impact life expectancy and quality in a way that intervention can improve. It's about weighing the risk of overtreatment against the potential, but diminishing, benefit of detection. Think about the anxiety of a false positive, the discomfort of the procedure itself, the radiation exposure over decades. These factors, while minor for a younger woman, accumulate and weigh more heavily as we age, and our resilience potentially decreases. So for women over 70, it's not about abandoning vigilance, but about having a candid conversation with your doctor about your personal health, your values, and whether routine mammograms truly align with your goals for healthy aging. Our second checkup to critically evaluate is routine Pap tests for cervical cancer screening after the age of 65 or 70. Again, Pap tests are undeniably vital for younger women, detecting precancerous changes and early-stage cervical cancer, preventing it from ever developing or becoming advanced. However, current guidelines from organizations like the American Cancer Society and the American College of Obstetricians and Gynecologists generally recommend discontinuing routine Pap tests for women over 65 or 70 who have a history of normal Pap test results and no history of serious cervical precancerous lesions. Why the change? Cervical cancer, particularly the kind that Pap tests detect, is almost entirely caused by the human papillomavirus, HPV. HPV infections are common in younger women and often resolve on their own. However, persistent infections can lead to cellular changes over many years, eventually developing into cancer. But here's the key. New HPV infections are very uncommon in women over 65. The immune system has usually cleared any previous infections, or if there were persistent infections, the precancerous changes would have likely been detected and treated long before this age. When cervical cancer does occur in older women, it's often in those who have never been screened or have not been screened regularly in the past. If you've had consistent, normal Pap tests throughout your 50s and 60s, the risk of developing new cervical abnormalities in your 70s and beyond is extremely low. Continuing routine Pap tests in older age carries its own set of harms. The procedure itself can be uncomfortable, especially for women with vaginal dryness or atrophy, which are common after menopause. It can cause anxiety, and false positives, while rare, can lead to unnecessary follow-up procedures like colposcopies or biopsies, which are invasive, painful, and carry risks of infection or bleeding. Furthermore, the likelihood of detecting a slow-growing abnormality that would become life-threatening within a woman's remaining lifespan diminishes significantly. Again, we circle back to the benefit-to-harm ratio. If the risk of developing cervical cancer is exceedingly low and the potential for discomfort and unnecessary intervention is present, discontinuing routine screening becomes a reasonable choice. Of course, any new or unusual symptoms, such as abnormal bleeding or pelvic pain, should always be discussed with a doctor, regardless of age or screening history. But for routine, asymptomatic screening, it's a conversation worth having with your healthcare provider about whether to continue. Our third checkup to reconsider is routine PSA testing for prostate cancer screening in older men, but we are focusing on women here. Oh, my apologies. Let me correct that. The third checkup to critically evaluate, specifically for older women, is routine colonoscopies for colorectal cancer screening for women in their late 70s and beyond, especially if they have had consistently normal previous screenings. Routine colonoscopies are incredibly effective tools for preventing colorectal cancer in middle-aged adults, as they can detect and remove precancerous polyps before they turn into cancer. For women in their 50s, 60s, and early 70s, this screening is often highly recommended. However, similar to breast cancer screening, the balance shifts with advanced age. The American Cancer Society recommends that people should continue colorectal cancer screening until age 75. Between ages 76 and 85, the decision to continue screening should be made with a doctor, based on a person's preferences, life expectancy, overall health, and prior screening history. After age 85, screening is generally not recommended. Why this age-based recommendation? Firstly, the growth at most colorectal cancers in older individuals tends to be slower. If a polyp is detected in an 80-year-old woman, it might take many years for it to develop into an invasive cancer that would impact her remaining lifespan. The average life expectancy at 80 is around 9 years. Would the benefits of early detection truly outweigh the risks of the procedure for someone with a limited life expectancy? Secondly, colonoscopies are not without risks, and these risks increase with age, especially for those with existing health conditions. The procedure requires bowel preparation, which can be arduous, dehydrating, and difficult for older adults, sometimes leading to kidney issues or electrolyte imbalances. The procedure itself involves sedation, which carries risks for the heart and lungs, particularly in those with cardiac or respiratory conditions. There's also a small but real risk of perforation of the colon, which can be a life-threatening complication requiring emergency surgery. The recovery from such complications can be much more challenging for an older woman. If a woman has had a history of regular colonoscopies with no polyps or only benign polyps, her risk of developing advanced colorectal cancer in her late 70s or 80s is significantly reduced. In such cases, the potential harms of repeated invasive procedures, the discomfort, the risks of sedation, the small risk of perforation, may outweigh the diminishing benefits of detecting a very slow-growing cancer that might never cause problems. The conversation with your doctor should focus on your overall health, your personal risk factors, and your past screening history. For some, less invasive screening methods like stool-based tests, FIT, or Cologuard might be considered if screening is still desired, as they carry fewer risks, though they might require a colonoscopy if positive. But for many, especially those who prioritize comfort and minimizing medical interventions in their later years, stepping away from routine colonoscopies after a certain age can be a wise and compassionate choice. Our fourth area of reevaluation for older women after 70 is routine bone density screenings, DEXA scans, every 1 or 2 years. Now, DEXA scans are incredibly important for diagnosing osteoporosis and guiding treatment, especially for women in their postmenopausal years and up to their early 70s, or for those with specific risk factors for bone loss. Detecting low bone density early allows for interventions that can prevent debilitating fractures. However, once a woman has been diagnosed with osteoporosis and is on a stable treatment regimen, or if her bone density has been consistently stable and normal over several years, the frequency of these scans might need to be reevaluated. The guidelines for DEXA scan frequency are often tailored to individual risk. For women over 70, if your bone density has been stable for many years and you are not on any medications that accelerate bone loss, or if you are already on treatment for osteoporosis and your bone density is stable, then annual or biennial scans might not be necessary. Why? Firstly, significant changes in bone density rarely occur quickly enough to warrant such frequent screening, especially if a woman is already on treatment or has stable bones. Secondly, the goal of treatment for osteoporosis is to reduce fracture risk, not just to improve the DEXA score. While DEXA scans provide valuable data, the decision to continue or change treatment should also be based on overall fracture risk assessment, which includes factors like age, history of falls, and other medical conditions, not solely on a small change in a DEXA score. The potential harms of overly frequent DEXA scans are relatively minor, primarily radiation exposure, though it is very low, and the cost. However, the greater harm can be the anxiety and unnecessary changes in medication that might arise from small, clinically insignificant fluctuations in bone density readings. Imagine a woman who is stable on her osteoporosis medication for 5 years. A routine scan shows a tiny, statistically insignificant drop in bone density. This might trigger a doctor to switch medications, leading to new side effects, or to unnecessarily increase monitoring, creating worry where little is needed. The focus should shift from simply measuring bone density to preventing falls and maintaining functional independence. This involves addressing balance issues, reviewing medications that can cause dizziness, ensuring adequate vitamin D and calcium intake, and engaging in weight-bearing exercises. For older women who are stable, a DEXA scan every 3 to 5 years, or even less frequently if risk factors are low and bone density has been consistently good, might be more appropriate. It's about smart monitoring, not excessive scanning. It's a conversation to have with your doctor, focusing on your individual fracture risk, rather than adhering rigidly to a schedule that might not be optimal for your specific health journey. And finally, the fifth category of checkups that older women should reconsider after 70 relates to aggressive or overly frequent screenings for cardiovascular disease, specifically focusing on invasive stress tests or extensive lipid panels when they are asymptomatic and already on stable preventative medication. Now, blood pressure monitoring, cholesterol checks, and general heart health discussions are absolutely critical at any age, and especially so for older women, as heart disease remains a leading cause of mortality. This is not about abandoning cardiovascular vigilance. It's about the intensity and invasiveness of certain screenings when there's no clear indication of benefit. For women in their 70s and beyond, if they are asymptomatic, meaning they don't experience chest pain, shortness of breath, or significant fatigue, and are already on appropriate medications for blood pressure and cholesterol, routinely pushing for aggressive stress tests, like nuclear stress tests or cardiac catheterizations, might not always be beneficial. Why? Firstly, stress tests can produce false positives, especially in older women, leading to unnecessary anxiety, further invasive procedures like angiography, and potential complications from those procedures, including bleeding, infection, or even heart events. Secondly, the treatment of asymptomatic coronary artery disease in very elderly individuals is a complex topic. While intervention can be life-saving for acute events, the benefit of aggressively revascularizing, opening blocked arteries, in someone who is completely asymptomatic and already on optimal medical therapy for chronic stable angina is less clear, especially when considering the risks of the procedures themselves and the potential impact on quality of life. The goals shift from extending life at all costs to preserving quality of life and preventing symptomatic events. Similarly, overly frequent or intensive lipid panel monitoring when cholesterol levels are well controlled on statins or other medications might be less useful. While checking once a year to ensure adherence and effectiveness is reasonable, chasing tiny fluctuations in lipid numbers with more aggressive medication changes might lead to more side effects without significant additional benefit in terms of preventing a heart attack or stroke in very advanced age. The emphasis should be on managing risk factors holistically, maintaining healthy blood pressure, controlling blood sugar if diabetic, not smoking, staying physically active, and eating a heart-healthy diet. For an older woman who is feeling good, living actively, and has well-managed risk factors, the focus should be on maintaining that state, rather than relentlessly pursuing ever lower numbers through potentially burdensome interventions. It's about being proactive in a wise, measured way, rather than a maximalist approach that could lead to overtreatment or unnecessary worry. The overarching theme in all these considerations is the shift in perspective as we age. In our younger years, the focus is often on maximizing lifespan through aggressive early detection and intervention. As we gracefully enter our golden years, the focus often broadens to encompass not just lifespan, but health span. The number of years we live in good health, with independence, comfort, and the ability to enjoy life. This means making healthcare decisions that truly align with our individual goals, values, and overall health status. It's about choosing wisely, not just doing everything possible. It's crucial to remember that this isn't medical advice for any individual. Every woman's health journey is unique. These are topics for thoughtful discussion with your trusted healthcare provider. You are your own best advocate. Come to your appointments prepared to ask questions. What are the specific benefits of this screening for me, at my age, with my health history? What are the potential harms or side effects? What would we do if the screening result was positive? How would a positive result truly change my management or quality of life? Don't be afraid to voice your preferences and priorities. It's your body, your life, and your golden years. Think about the bigger picture. Sometimes the most beneficial checkup isn't a medical test, but a regular check-in with your own well-being. Are you eating nourishing foods? Are you moving your body joyfully? Are you nurturing your social connections? Are you finding purpose and meaning in your daily life? These are often the most powerful determinants of health and happiness in our later years. Medical screenings are tools, and like any tool, they are most effective when used judiciously and in the right context. We often feel pressure to comply with every recommendation, every test. But as we age, we gain wisdom, and that wisdom allows us to discern. It allows us to ask, is this truly adding to my well-being, or is it adding to my burden? It's about empowering yourself to make informed decisions that honor your body, your spirit, and your desire for a fulfilling life, free from unnecessary medicalization. So, let's recap these 5 areas for reconsideration. Routine mammograms, especially for those over 75 or with limited life expectancy. Discuss if active surveillance is more appropriate than routine screening. Routine Pap tests. For women over 65 to 70 with a history of normal results and no risk factors, consider discontinuing. Routine colonoscopies. For women in their late 70s and beyond, especially with clear prior screenings, weigh the increasing risks against diminishing benefits. Overly frequent DEXA scans. If bone density is stable or you're on effective treatment, discuss extending the interval between scans. Aggressive cardiovascular screenings, e.g., invasive stress tests. For asymptomatic women already on stable preventative medication, question the benefit of invasive or very frequent testing. The goal isn't to neglect your health, but to streamline your healthcare, making it more effective, less burdensome, and more aligned with your personal vision of healthy aging. It's about choosing quality over quantity of interventions. It's about finding that sweet spot where medical science supports your life without overwhelming it. Thank you for joining us on Golden Years Health. We believe in your power to make informed choices and live a vibrant, joyful life at any age. If this conversation resonated with you, please give us a thumbs up, share this video with someone who might benefit, and subscribe to our channel for more practical tips and empowering discussions. And as always, we invite you to share your thoughts and experiences in the comments below. Your wisdom enriches our community. Until next time, take good care of yourself and remember, your golden years are meant to shine brightly.